you'll be good to go.
Right, well, good evening, everyone. This is the meeting of the Hall Green South Ward Forum, and I'm Councillor Tim Huxtable. The first notice I've got to give is that this meeting is being recorded, and please do speak to me if you have any problems with it being recorded. You're allowed to take notes or take photographs during the meeting, except where there are any exempt items, and there are no exempt items on today's agenda. Does that cover that, Kay?
It certainly does, thank you.
Excellent. Right, our first item agenda is the presentation from Health and Wellbeing, and we have Damilola to do it. So without any further ado, Damilola, you're very welcome. Please make a start.
Thank you, Councillor. Good evening, and thank you for inviting me over to this ward meeting today. I'll be presenting the draft Birmingham Health and Wellbeing Board strategy for 2022 to 2030. And I'll share my screen so you can see my presentation.
Okay, yes, I can see it.
Okay, and so this is the draft, Creating a Bolder and Healthier City. This is the draft Birmingham Wellbeing Board strategy for 2022 to 2030. So public health at the council are here on behalf of the Health and Wellbeing Board, and we in public health are responsible for protecting and improving the health and well-being of the population. We also have a specific responsibility to reduce health inequalities. For example, the gap between the health of the richest and the poorest in the city. And the Health and Wellbeing Board is a place for political, clinical, professional, and community leaders from across the care and health system to come together in Birmingham to improve the health and well-being of their local population, and also to reduce health inequalities. So they've been in place since 2013, when they were established through the Health and Social Care Act of 2012. And through the Health and Wellbeing Board, we work with organizations such as the NHS to improve the integration of services and work together to improve health and well-being and tackle health inequalities that have been worsened by COVID-19 pandemic. So the strategy sets out the Health and Wellbeing Board's ambitions for the next 8 years based on a series of themes and cross-cutting approaches. And Birmingham City Council's Health and Wellbeing Board will oversee this strategy. Okay.
Yeah.
So how the strategy was developed. This strategy was shaped and developed over the past 3 years, just building on some of the learning and incorporating experiences from a green paper that was presented in 2019 with Consultation, including the JSNA, that's the Joint Strategic Needs Assessment, the Seldom Heard Focus Groups, Ethnographic Research and Insight Surveys over 2020 and 2021. Now, the delivery of the strategy will require leadership and action from the Health and Wellbeing Board's sub-forums and partner groups. And the proposed approach is for the strategy to be a framework that signposts actions across the health and care system. So our vision, the board recognizes that, the importance of this framework interconnecting with the emerging priorities of the NHS's integrated care systems and their duty to address inequalities and the responsibilities and strategies of the Police and Crime Commissioner, as well as other public sector businesses, academic and community partners. So the vision, our shared vision is to create a healthier city where every citizen at every stage of their life in all communities can make healthy choices that are affordable, sustainable, and desirable to support them to achieve their potential for a happy, healthy life. So the vision is underpinned by the following principles for action. So citizen-focused and informed by citizens' lived experience, consciously focused on reducing inequalities, consciously promoting equality and inclusion, data and evidence-informed and research-enabled action. So the framework has 5 core themes. Now, across the top, for action, covering wider determinants, health protection, and environmental public health. So these 5 core themes run through the life course, which is split into 3 stages, and you can see that across the bottom, and that's getting the best start in life, working and learning well, aging well, and dying well. So the strategy contains 2 cross-cutting approaches, and it's present across all the 5 core themes and the life course. And these approaches are, to mitigate the legacy of COVID, and then equality, diversity, and inclusion. So closing the gap runs through the entire strategy. So as I said earlier, the framework has 5 core themes for action. Now, 4 of the core themes in the framework align with existing sub-forums. So we have the healthy and affordable food, mental wellness and balance, active at every age and every ability, contributing to a green and sustainable future, protect and detect. Now, the healthy and affordable food is aligned with the creating a healthy food city sub-forum, the mental wellness and balance, that's aligned with creating a mentally healthy city. Active at every age and ability is aligned with creating an active city. And the last one, protect and detect, is aligned with the Health Protection Forum. So the 4th one, contributing to a green and sustainable future, we don't have a sub-forum specifically designed and aligned to that, but it's our role within public health to contribute to this as one of the core themes. So the Health and Wellbeing Board supports a life course approach, and this is reflected in the framework, aligning with the Birmingham and Solihull Integrated Care System Outcomes Framework. The 5 core themes run throughout the life course, which is split into 3 life stages: getting the best start in life, working well, aging, and dying well. The framework has incorporated experience and responses to the pandemic alongside the ongoing commitment to equality, diversity, and inclusion. Now, the framework contains 2 cross-cutting approaches present in all 5 core themes and the life course strands. So like I said earlier, to mitigate the legacy of COVID and equality, diversity, and inclusion. Now, the Health and Wellbeing Board is committed to reducing inequalities. The aim of the framework is to close the gaps and the inequalities at pace and scale across the city, which Health and Wellbeing Board sub-forums will be tasked to demonstrate their progress on throughout their action plans. So closing the gap section aims to address the health inequalities linked to poverty, marginalization, structural barriers, and challenges that are in place. So there are 5 key areas of inequalities of focus, and they include inequalities based on deprivation, inequalities based on ethnic communities, inequalities based on wards, inequalities between inclusion groups, for example, the homeless population and sex workers, and inequalities affecting disabled people. So one of the key areas for the strategy is to make sure that we're measuring impact. And we'll measure the impact of the strategy over the next 5 to 10 years. And delivery groups will identify specific and measurable indicators that can be used in the short to medium term to track change and inform the delivery of the strategy. So as you can see from these indicators, it presents Birmingham as significantly worse than the England average in a majority of the indicators that are presented on this slide. So if you look at infant mortality, for example, you can see how far removed from the center line that red dot is there. And so we're doing significantly worse off than the England average on that indicator. If we look at life expectancy at birth, we can see again that Birmingham is doing significantly worse than the England average.
Can I just stop you there? Do you have any slides for Hall Green South specifically?
No, unfortunately, I haven't brought any specific slides for Hall Green South.
Because I just wondered, I accept this is the Birmingham data compared to England. I just wondered if there was any available data for Hall Green South compared to Birmingham or Hall Green South compared to England, given that, how do I put this, that Hall Green South is probably regarded as one of the least deprived wards within Birmingham.
That's something I can have a look at when I get back, and we can send you a response to that, comparing Hall Green South with the rest of Birmingham or compared to the England average.
Because what I'm well aware of in terms of past publications by Birmingham Public Health is they've taken train lines and they've taken stations along train lines and looked at life expectancy along those lines, and the view is that the further out along the train line, the greater the life expectancy is of the residents living in that community.
Yes.
And as you may or may not be aware, within Birmingham, Hall Green South is right on it's the last train station along that line going out towards Stratford from the city centre. So I just wondered how, as I said, Hall Green South actually compares. But that data, if you got it or can share it at some time, would be very useful.
Yes, Councillor. So I'll take that back and have a look at it to see if we have that data with the comparison. And if we do, then we'll forward it on to you.
That'd be brilliant. Thank you.
Thank you.
Sorry, please continue.
Yes, so like I was saying, these indicators, just most of them show Birmingham is doing worse off than the England average, except in inequalities in life expectancy at birth and inequalities for male and female, but it's significantly higher, but it is worse off, so if inequalities are higher, then it's showing us as being worse off than the England average.
Yeah.
Okay. So the draft strategy and consultation can be found on Be Heard. And we have the link here. And if anybody on the call has their phone with their smartphone, you can just, go using this QR code, and that will take you straight there for you to be able to complete a response and go through that. We would appreciate, as many people as possible filling this out. So if you can go to the Be Heard website to give us your feedback, please think about how what you read in the document can inform the ward plan. And you can also ask questions to the Health and Wellbeing Board meetings if you wish. So I'm going to be circulating this presentation afterwards so that everybody can have a copy of that and just go through it. And if you do have any questions, please do feedback.
Well, the first question is, how long have people got to respond? Because if residents are watching this on Birmingham YouTube, what is the closing date for consultation responses?
The closing date is the 20th of December, I believe, but I'll just confirm that as well. Yeah.
Okay, because as I say, Kay tells me this is going to be put on the City Council's YouTube. So if you're watching it before the 20th of December, please do get involved, undertake the survey, and be heard at Birmingham City Council. Be heard.
Yes, thank you.
Kay.
Yeah, Councillor Huxtable, if Darry can send me the presentation, I'll circulate it to the ward mailing list so everybody's got a copy of the presentation and the links to how to respond.
Okay, that would be fantastic. Is that okay, Daniel?
Yes. So I'll send a copy of the presentation to Kay. And if there are also any questions, they can also feedback through the email address, Health and Wellbeing Board Strategy at birmingham.gov.uk.
Brilliant. Thank you very much for that very informative presentation.
Thank you, Councillor.
Okay. Right. Next item agenda, moving swiftly on, was going to be a police update from the Hall Green Neighbourhood Police team. I don't think any officers from the team are available tonight, and I don't think they've sent a written summary. Is that correct, Kay?
Yeah, that's correct, unfortunately.
Right. What I will say is that we've recently had a new sergeant, Sergeant Thomas, come to take charge of the Hall Green Neighbourhood team. I have actually met with him to discuss issues constituents have raised with me in terms of policing. We are in frequent contact via email. I'd like to publicly thank Sergeant Thomas for all his efforts during the time he's taken over the Hall Green Neighbourhood team. I think he's an excellent sergeant, and I hope that we built and continue to build a strong working relationship. Again, if you're watching this on the City Council YouTube, if you have any policing issues, please do contact me direct, and I will ensure that any concerns will be looked at by the Hall Green Neighbourhood Police team. And that is essentially all I can say. And the fourth and final substantive item on the agenda is the Hall Green South Ward priorities. Before it can be formally adopted, we have to show that it's gone to a ward forum, and it has been circulated as part of the agenda pack. Kay?
It has indeed. The whole ward plan and the ward priorities action sheets been circulated to everybody on the mailing list with the agenda and invite to the meeting. And
all I would say is this list and of plans and proposals and priorities have been drawn up in response to comments from residents, which have been numerous in terms of the 3.5 years I've been a councillor here. And the number of comments and don't know what the other phrase is, but the number of comments from residents about what they like about Hall Green, but what they would like to see improved, have been the subject of numerous petitions that I presented on behalf of constituents of Hall Green South to the City Council. ranging from the need to resurface numerous roads in terms of local centres and the need for more investment in our local centres in terms of the environment in Hall Green, you know, the litter and action needed on fly tipping, and having meticulously gone through all those comments, whether they've been from emails, letters, telephone calls, or raised from me when I've been out and about in Hall Green South, they've all been fed into the ward plan and priorities and proposals going forward, which is what has been circulated. So formally, I would like to adopt it as part of the Hall Green South Ward Forum. And then Kay, I believe the process is having taken it to Ward Forum, you will then be in touch with the Neighbourhood Development Support Unit to let them know that there's been an opportunity to discuss it at tonight's forum and that it has been adopted. But of course,
I will do that for you, Councillor.
Thank you very much, Kay. But of course, again, if you're watching on YouTube at any time, please do contact me regarding anything that you feel could be added to the plan, because I see it as a living, breathing document, not a document to sit on the shelf gathering dust. I always think there's room for improvements, and the best people to know what those improvements are local residents who live, work, study in Hall Green. And if there's any comments on anything that's already included in the plan, I'd also be very pleased to hear that. And you can contact me on my email address, which is timothy.huxtable@birmingham.gov.uk, or you can phone my group office at the Council House on 0121 303 2130. That's 0121 303 2130. And I'm always happy to hear comments, views, suggestions as to what we can do better from local constituents.
Councillor Huxtable, we can also take the ward plan to a future meeting and discuss further the priorities and update what, if there's any additions that people want to make, or remove things that have actually been actioned.
Well, I think that's an excellent idea, Kate. As I said, I want to see it as a living, breathing document. So I don't mind having it as a standing item at every ward forum. And I'm very keen, as soon as public health permits, for us to get back to physical meetings within the ward, and so people can actually have their say in that type of public forum.
Right, okay, yeah, I've made a note of that. We'll have it as a standing item.
Thank you very much. There being, I don't believe, any other business, Kay?
No, there isn't. That's it, I'm afraid.
There being no other business, I would just say, if you are watching this back and you want to get involved, please do contact me. It's always lovely to have as many residents as possible actively engaged in Hall Green's civic life, civic affairs. So thank you very much indeed.
Thanks,
and with that, good night, everybody.
Good night. Thank you very much.
Good night.
Thank you.
Thank you very much.